give it a minute. Okay, I think we're live. Yeah. All good.
Hello everyone, welcome to the Horton Maternity Hospital. I'm Leslie, I'm the team lead for the community midwifery team and also the MLU. And here with me today I've got Rachel and Tammy.
Hello.
Today we'll be talking about the MLU and all of the other services here at the Horton Maternity Hospital. We welcome your questions and comments, so please send them in to us. And we'll address them towards the end of the session. We're hoping to have a few guest appearances from other members of the team along the way. So I hope you enjoy the session and please do send in your questions and comments. Thank you.
So the first thing that we wanted to talk to you about was why you might consider having your baby here at the Horton. So we know that midwife-led units are safe and a really good choice for women who meet the criteria for them. So anyone who's thinking about coming here to the Horton would need to have a straightforward pregnancy, fairly straightforward medical history. We do require women to be between 37 and 42 weeks pregnant. So your midwife, your community midwife will be able to talk to you about whether here would be a suitable option for you to have your baby. So if you meet those criteria, it's a good choice for you. So some of you may have heard of the birthplace study, which was done a few years ago now in 2011. It was a really big study that looked at about 65,000 women, and they found that midwife-led units were actually a really good choice. Women who were able to birth had less intervention than being an obstetric-led unit, so women who were low risk and had babies had the same outcomes. So that's why it's a really good piece of evidence that we know that midwife-led units are safe and a good choice. And the NICE guidelines, they also recommend them if it's for first-time mums and also mums that have had babies frequently. Oh, sorry, subsequent babies.
Yeah. So we aim to, at the Horton, we aim and throughout the MLU aim to provide a homely birth environment for the mums and the partners that come in. And we like to do this by providing things like low lighting. So we've got a dim switch. We're actually at the moment in the pool room, which is probably the main choice of room to birth in here, because we have got our pool, which is literally just behind Rachel. So we've got low lighting actually in the main room. We've got up lighters, which I don't know if you can see that are on. We've got some candles floating away in the back.
Let's do a little tour of the room.
Around the room.
We just should we start over here?
Yeah.
Okay.
So we've got so we've just got sort of different stations, and it's really nice to have sort of different stations because we don't want you to be on the bed. We want you to be nice and mobile during your labour, because we know that upright birthing is a lot easier and nicer for you and your baby. So we've got we have got the bed here, but we wouldn't necessarily promote going on the bed. If you wanted to, that's absolutely fine. This goes into lots of different positions. We've got the end of the bed has this lovely handle, which I found great for me when I was in labour. I had my babies in this room, and there's a ball that you can sit on the end, and you can lean your pillows over. So again, it's a really nice place to go. In the room, you'll see that this is the Sonicade that we will listen, because we're an MLU and you're low risk, so we'll be intermittent auscultation that we do. So they're in each of the rooms, and again, it's a blood pressure cuff, but that's pretty as medical as we sort of go in looking in the room. Over here, this way, can we just say we've got an ensuite toilet just here. So yeah, you can go in.
Have a little little peek.
And there's a shower in there as well. With COVID, we're wanting really to sort of have try to reduce the flow of your birth partners coming in and out. So, which I think I'm going to talk about it in a bit later. But so that's obviously you've got a toilet there. And if we come around here, we've got the pool that you can use, which again is really nice because you can just be as mobile as you can, and you can get into sort of different positions. We've got a birth stool there, so some more birthing aids that you can use. Bouncy, the birth ball is here. And then here we've got a really nice couch that you can, again, just this is another station, another place that you can get yourself in, and then there's a bean bag underneath there. So we really like to promote you to be, upright, mobile, and just try and get into your own sort of space. Your birth environment is so important through your labour because it just allows your hormones to do exactly what they should do. So making yourself that really lovely birth environment would really help you in your through your labour. So I think
we've got some diffusers as
diffusers.
well.
So aromatherapy. Sorry, Massage is huge as well. So again, if you're not sure about how to do the massage, we can show you different positions you can use. You can use the lower back. Your feet are a really good thing to massage. Your arms, your legs, anywhere really, and we can give you some oils as well. Like Rachel said, we've got aromatherapy. We've got the diffusers that you can use through that. We've got stations in the wall that you can have interlocks if you felt like you wanted something a little bit more as a coping strategy. Which
there's one here by the pool.
Yeah, there's one in the toilet, so you can still, don't worry when you leave the toilet, you can still use it in the toilet. And there's one over here again if you did want to birth over this side of the room. And then we also provide on the MLU Meptid. So if you did feel like actually you needed that extra bit, then we do give the injection of Meptid too.
Right.
If when you are in labour, the midwife who would look after you when you came in would be the midwife who is on the MLU. So the MLU is staffed by a midwife 24/7. There's always a midwife and a maternity support worker on shift. Once you're in established labour, then we would then call a second, or they would then call a second midwife in for your actual birth. Excuse me. So so that we're always around for you.
So we often get asked, what if there's more than one woman in labour at a time? We do just have the one pool here at the Horton Midwifery Led Unit, but we have another very, very nice birthing room as well. So all of the comfort measures that have already been mentioned today can be used in the other birthing room as well. Very, very occasionally we might have a third lady come in to have her baby, but that would be very unusual. We would then draw not just on the on-call midwife from the community team, but from the wider community teams in the north of the county. For example, Chipping Norton and Bicester, because we are very familiar with supporting each other for births, both in the MLUs and also at home. So although we do just have the one pool, if you want to use the pool and somebody is already in the pool, it may be that we can time it so that you're with us for a little while, and then we can move once the other woman has vacated the pool room and has delivered her baby. We can move you into the room. We do need a little bit of time to turn the room around, to clean it thoroughly, so there may be a short delay there, but hopefully not too long for you.
So one of the things that we wanted to talk about today was transfer in labour, because it's a question that we often are asked about women, people who are considering coming here. It's quite a common anxiety. So we really just wanted to take this opportunity to reassure people. So generally for midwife-led units, the transfer rate, if you've had a baby before, is about 10%, and if it's your first baby, it's usually about 40 to 45%. So you're more likely to stay here and not be transferred in labour or afterwards than you are being transferred. So we want to reassure you that most of the time, if a transfer is required, it's for reasons that are not emergencies. So it could be something like your baby's had a poo in your waters, so meconium, and we need to do some extra monitoring. It could be that perhaps your labours may be taking a little bit longer than we would usually see, or if you wanted an epidural, obviously we can't provide that here. So really it's often reasons like that that we may decide to go to the John Radcliffe for transfer. So you know, occasionally we do have other situations, but as midwives we train, you know, every year we're doing training and updates on dealing with these situations. We're very familiar with how to handle those, and we do it exactly the same as we would if we were in an obstetric led unit, but obviously it's useful to have extra hands and extra resources. So we just really want to put your mind at ease over that transfer scenario. We are fortunate here at the Horton to have an ambulance on site, which some of you may have seen when you've come for your appointments. So we use St John's to transfer to Oxford, so it's fairly swift if it's necessary. The midwife that's caring for you will transfer with you, so they'll stay with you until you arrive, and then hand over to a midwife that's based in Oxford. Usually partners will drive behind, just for practical purposes really, so that their car and your car is there for when you're ready to go home. So it's really not as daunting as it seems, and actually you're more likely to stay here and have a really positive birth experience and less intervention, so that's why we're promoting them.
So then once you had your baby, you might decide that you want to go home pretty soon after, which is absolutely fine. Or it might be that you decide to stay with us a little bit longer, and maybe if you wanted some feeding help, then again that's absolutely fine. That's something that we really would like to offer, and we do offer quite regularly to ladies and their partners. If you were going to go home, or you wanted to go home sort of soon after, then you would go home from the delivery room. If you wanted to stay, then we would transfer you to one of our postnatal rooms for the care that you wanted with helping feeding the baby. You may also want to stay a little while to have it's called a NIPE check for your baby, which is the newborn
Initial examination.
Thank you, that's the word. So, and again, if you wanted to stay and it sort of fitted with you, then that's absolutely fine. We just move you to the postnatal room, and we would arrange that, and then once you felt that you wanted to go home, then you could go home from there.
That sort of leads us on to the other services that we provide here at the Horton. So we're really lucky. We're one massive team here, and we've got lots of different areas, which is really nice, and we all work together. So as Leslie mentioned, we're going to have a couple of people from the different areas pop in and just introduce themselves, which will be nice, and you'll probably recognise a few faces.
Yeah.
So as Tammy mentioned, we have a NIPE clinic here, so that runs in the weekdays. So you know, if you go home fairly quickly, even if you're in another area, you might perhaps have your NIPE examination here the day or 2 days after you have your baby. So that has to be done within the first 3 days after birth, like a top to toe check of baby. And then we've got our hearing screeners, which are here most days, so they'll talk about what they do. And we've got our assessment clinic as well, they'll be popping in. And the community midwives, which we're all part of. So we work really closely with the midwives on the MLU here, as Tammy mentioned, we'll come in and possibly look after someone in labour if we've got 2 women here, or we come in as seconds, so we do on calls, don't we? Day and night where we do on calls, so maybe
some of the community midwives actually work within the 2 areas, don't they? So some work on the MLU and on community, so again it's just another face you might see.
Yeah, just a nice team environment, isn't it? Which I think as community midwives, we also wanted to use this session just to mention a little bit about home birth, because that's also something that is a choice for women in our area. So we're really lucky to have the facilities to offer home birth, MLUs and obstetric led units. So I think Les is going to talk a little bit about that.
We're very happy to support you if you wish to have your baby at home. It's a discussion that you would have with your own community midwife, your named midwife. That's the midwife that you see for your antenatal appointments, either here at the Horton or at your GP surgery. So during the COVID-19 pandemic, we have been running almost all of our clinics here from the Horton. We're now going back out into the surgeries, and so it will be the midwife that sees you for your antenatal appointments. And if you express your interest, the midwife can then talk you through the process of planning and the preparations that you may need to make, and point you in the right direction for lots of information about having your baby at home. Of course, not everyone would be perhaps suitable to have their baby at home. There may be some additional risk factors, but we will support you through your decision-making process as best we can, and we would always support you along the journey and for ultimately your lovely home birth. I think at this point I'd just like to say hello to some of my colleagues who are watching but staying outside of the room, and invite them to come in and say hello. So I know Rachel's watching, possibly with a few other people in the background, and we've got Sarah and Ali watching from home, so hello to you. So anybody that wants to come in and join us and say hello, that would be lovely. The door's still not opening, but you never know. And I don't know at this point whether we want to, perhaps while we're waiting, answer some of your questions. Yeah.
Something that I didn't mention actually before about the services that we have is also feeding support. So pre-COVID, we would have the infant feeding clinic here once a week, which isn't with us at the moment, but I think it's really nice here to know that if you go home, no matter where you have your baby and you need a bit of extra support with feeding, there's somebody here day and night that you can phone. You know, if it's the middle of the night and you just want to ask someone a question for reassurance, you can call. And you know, we quite often, maybe less so at the moment, but we would have people come in for some feeding help, just stay for an hour or two just to watch a feed and support you with that, which is nice. Just like that. So let's have a look at ours. So Harriet has asked how many pool rooms are there? So I think she just missed the start of that.
Yeah, so this is the pool room. So currently we've got the one pool, which is, like I said, it's just behind Rachel. And then Leslie, you covered that. You know, sometimes we do have more than one lady in labour, but it often not. It does tend to just seem to work out. I don't know how it does, but it just does seem to, whether you all know between you what's going on. But if we did have a lady in labour and you did want the pool, then as soon as that was available and she delivered, then you know, we would do our utmost to try and you know, sort of turn the room around so that then you could come in.
And I think as midwives, we're really good at advising you on other comfort measures that you can use. So, you know, if the water's not available, which is often what a lot of people are quite keen to use, we can use heat packs, cool packs, massage, like Tammy was saying. There's loads of other things that we can do to help guide you through that. And then if the pool becomes available, we just
A special hello to Rennie, who's watching us from Sri Lanka.
Oh, hello, Rennie.
Hello, Rennie. We
Come
miss
back
you.
soon. We've gone international.
We have, that's amazing. Spread the word.
And Amber says hi from one of the earlier comments. Hello, Amber.
Hello, Amber. I've got a question from Vanessa. So she said, do you offer aromatherapy during labour at Horton? We do.
Yes, we do.
Yeah. So we've got, you probably just missed our little tour that we did. We've got a couple of diffusers in the room at the moment. We all love aromatherapy.
Yeah.
So we know what oils can be used and reasons why you might choose those oils. You know, depending whether you want something for relaxation or maybe if you're feeling a bit nauseous in labour. So there's lots of different reasons, like something that's kind of uplifting. So we can guide you. We can put them in a base oil, so we can show your partner how to do some gentle massage on your, particularly your back, which can be nice. So yes, we have got room for it.
Yeah, it can be used through massage, like say, or the diffuser.
Yeah.
Haley's just come into the room actually. Did we want to do? Should we move on to Haley? Should we do a couple of questions? Yeah. Okay,
Let's move on to Haley.
so I will move out of the way so that we're all keeping our distance.
Haley's joined us from MAC, the Maternity Assessment Clinic, and I think he's just going to say a few words.
Yeah, so just a bit of a brief description about where we are, what we offer. So we're based within the Horton Maternity Unit. As you come in, we're just left down the corridor. And we're open from 8 o'clock in the morning to 4 o'clock in the afternoon, Monday to Friday. We see women that have had babies before, or they may be having their baby for the first time. One of the criteria that we need to meet is that those women are over 16 weeks gestation in their pregnancy. Women that need advice that are much earlier on in that pregnancy can still call us. We wouldn't be able to bring them in and see them for any concerns they may have, but we can signpost to the right areas to make sure that they're getting appropriate care. So what do we do in Maternity Assessment Clinic? We do lots and lots of blood tests. So they're blood tests that their community team may be referring those women in for. A woman may be at home and she might have a symptom of something. She can call us for advice and we will bring her in for a blood test. And then the other blood tests that we do on a daily basis are blood tests for screening for diabetes. So if we had someone that had some screening and they had a positive result that meant that they needed care under the diabetic team, we then arrange and put those referrals in place and communicate really closely with the community team. One of the things that we do as well on mostly a daily basis is we see women that may be having concerns that there is a change in the pattern of their baby's movements. That may be a reduction or just a change. So most women will have a pattern, and if they notice that their baby's movements digress from that pattern in any way, the safest thing to do is to give us a call and to talk through that. And then in our assessment clinic, we have 2 monitoring machines that we can look at your baby's heart rate over a period of time, not just a quick listening with our sonocator. So it's a bit more than a snapshot. So we use those monitors, they're called CTG monitors, and we use those to make sure we're happy that that baby is not experiencing any distress, and in hindsight has perhaps just having a quieter day or has changed what they're doing with their pattern. And then again, for those women, we make an onward plan with how we then continue that care. We have women that have to come sometimes on quite a regular basis. Perhaps they have, they're taking medication because they've had a raised blood pressure, and they see their community midwife for their routine appointments and the extra blood pressures, but actually to factor some extra ones in, they may need to come to us in MAC for urine dipping to check that you haven't got anything there that needs further checking and that your blood pressure is stable. Again, if someone came to us and we found something that was abnormal, we'll put the right pathways in place. Women phone us with all sorts of queries. You can phone us with any query, it's absolutely fine. We have quite a strict criteria of concerns that women may have that we can actually bring in and see, and that's because like these guys, we're running within a midwife-led setting, so we don't have any obstetricians or doctors to review certain concerns. So things like if women are experiencing pain, that's not necessarily going to be appropriate to come to us, but we can advise on the phone, we can go through everything with that woman and then make sure that you're seen in the correct place, or that you may not even need to be seen at all. So we're always happy to take calls and make sure that women get the right care that they need. We're always accessible, so if you ever feel that you need to talk to a midwife and you can't get hold of one of your community team, again, as I said, from 8 to 4, you can call us. Outside of our hours, if you need some advice, we always suggest to women that they call the Maternity Assessment Unit at the JR in Oxford, because they're 24 hours a day, and they're the ones that have the obstetricians. So if it's something that we can't see you for because it falls outside of the remit of a midwife, we often refer you to that department to have a review.
Right.
Yeah.
Yeah. So we work really well with, like, closely with the assessment clinic, which is nice.
Yeah, you guys refer a lot of your women through to us, and sometimes you'll do that in advance, won't you? Or sometimes you might pick up the phone there and then and say, you know, this woman needs to come in. So it works well.
Okay, thank you.
All right, you're welcome.
Yeah.
Okay. All
You're
right.
welcome to stay, but if you need to go on.
Yeah, we've got some women coming in.
Okay.
All right.
Thank you. Another question here from Laura. I think, Tammy, we rehearsed this answer, didn't we? So you can tell me. How long are partners allowed to stay after the birth with current COVID restrictions in place? Over to you.
Okay, so as I was saying earlier, once you've delivered your baby, if you know that you're wanting to go home sort of straight away, then in effect you're all still in the, so say if you've delivered in the pool room, which is where this room is where most ladies deliver, then we would then do all your discharge paperwork, and you could actually go from here. So you could then both go, because you're still, in effect, you're going sort of straight after having your baby. If we were to move you out of the room and you wanted to stay for a longer period of time, and we moved you into a postnatal room, then that's when your partner would then say their goodbyes, and you would move into the postnatal room, and then come and collect you the next day when you're ready to go home. So I hope that answers your question.
And a question from Liv. If you have a straightforward birth with no complications, how long roughly after would it take to be discharged? And there's another part to this question, but Tammy has covered some of that. It varies. You may you and baby may be well enough to go home 2 to 3 hours later. I would say probably the average stay is a little bit longer than that, maybe 6 hours. Or you're very welcome to stay in for 24 hours to just recover and be helped with some feeding and some initial baby care. So it very much depends on the individual and the birth that you've had in your baby. The second part to Liv's question is the postnatal room private or more like a ward? All of the rooms here are individual rooms, so it would be a private room, and although the bathroom in the pool room is en suite, in the other rooms the bathrooms are very close by, extremely close by actually. They're just not integral to the room. So I hope that helps, Liv. And then a question from Nikki. What are the key things to bring with you in your hospital bag?
So I think it's always a good idea to have like a bag for yourself and a bag for your baby. If you're super organised like me, it makes it easier then, doesn't it? So like Leslie said, you're probably only maybe staying for possibly one night, but I think it's good to prepare a few outfits. What else for mums?
So you want to be, see, I did it a bit different. I did a labour bag and then a just in case bag in the car. So,
That's a good idea.
so only because I hope my husband is watching, but it would have driven me insane if he'd have ruffled through my bag and unruffled all my nice things when I was nesting into my bag. So I did it slightly different, but you can do it as you feel. But basically, you just want one of everything for once you've had your baby. So the baby needs a baby grow, a vest, a hat, although we love to give our little hats out for you to then to take home, yeah, a blanket, and then the mummy will need something to get changed into afterwards. So whether you want to get into your pajamas or some comfy clothes, depending on how you feel, some lounge clothes. You'll obviously want underwear. Just buy some really cheap sort of knickers that you can multi-pack from a supermarket that you can that then if you want to get rid of, you can just get rid of. And think about buying maybe slightly bigger size underwear as well, because you've got to allow sort of not everyone goes back to their original size. A feeding bra or like a vest sort of bra top, what do you call them, that kind of a supportive bra. And then obviously your toiletries as well. You might want, what else have we got?
Shower gel.
Yeah.
Lip balm is a good one.
Lip balm, yeah, because if you're using Entonox, your mouth and your breathing, even if you don't use Entonox, you're breathing so heavily and you're really focused on your breathing that your lips get so dry. So it's really that's one thing that you'll find that you do. Also bring a drinks bottle, so something that you can constantly drink, because we literally just have like little paper cups. So brings a nice water bottle so that you can just keep yourself hydrated in labour. And then also, I don't think I mentioned it when we were talking about birth environment and what we offer, but actually music. Like think about, what do you want to listen to something in labour as well? So again, you might want to have a playlist, or you might want heavy metal. Some ladies do. I liked music with no words.
It's anything that makes you feel good,
Comfy.
really.
So we were talking about birth environment, making your birth environment very homely and feeling like you're secure, and all of those things are going to make you feel secure. And then your just in case bag in the car could be that actually your baby maybe doesn't jump on the breast and you actually feel like you need a bit more help, then and you do want to move into one of our postnatal rooms, then actually that would be a great time to then get your other bag and then have just one of everything again. So you might want another set of clothes for your baby, maybe two, because they can be a bit sicky during, initially, because it can sometimes be a bit mucusy. Just so anything really that makes you comfortable, that you sort of home from home. I bought arnica in, so that's again might be something. Nipple cream, you might want to think about putting that into your bag. There's lots of different lists that you can get online that you could Google.
We've got one amongst our team, which is quite good.
Absolutely.
So if you're in Banbury, you could ask your midwife, or if not, I'm sure whoever your community midwife is.
But also many of you may have downloaded the free Mother and Baby app, and there's lots of information on there about preparation for labour and birth, and it includes a list of things
and
to
talk
bring.
to your midwife as well, because I know that obviously we're not seeing you as much, but we're still here. So if you need to talk to a midwife and we're still here. We're a 24-hour service, so the MLU, there's always a midwife here, or just contact your community midwife and leave a message in the on the phone or in the office for your midwife to contact you back, and we will leave a note for them in their pigeonhole so that they get back to you. So we're always here for you.
And when it comes to going into the pool, some people wonder what to wear. Most of the time women just go in naked, and that's nothing new to us.
Right.
But we want you to be comfortable, so you might wear like some kind of top, like like a bikini top,
like a
or
tankini,
something that you can just take off
vest
easily.
top.
That's the key. Once your baby's born and you want to do skin to skin, something that you can whip off quite quickly.
The little bras that, what are they called? The ones that have no wire or anything, and they're just like little, like almost like a vest top, but it's not like a bra. Yeah, they're really great to wear. Anything sort of like that.
Courtney's asked a question. Do you have to be 4 centimetres dilated before your partner can come into the unit with you like the JR. Well, we've got a little update for everybody on that, which is great news. If you come into any of our hospitals, so here in Banbury, or at the JR now, or at Chipping Norton, Wallingford, for a labour assessment, your partner can now come in with you. So for your labour assessment, you probably don't need to bring everything with you. You can leave it in the car, and then your partner can pop out quickly and get it. So your partner can come with you for your labour assessment, so it doesn't matter how many centimetres dilated you are at that point. So that's good news, everyone, isn't it?
Brilliant news. They will need to wear a mask.
Yes, they will need to wear a mask. Yes, yeah. So we've just got another guest appearance here from
Take your mask off.
from Katie, who will introduce herself and just tell you a little bit about her role here at the Halton.
Yeah.
Over to you.
Hello, I'm Katie. I'm the lead sonographer here at Halton. So I've got a group of 7 sonographers scanning, some of us full-time, some of us part-time, scanning a range of different obstetric scans, so nuchal scans, anomaly scans, growth scans. So yeah, we do all of the sort of antenatal scans and then refer people on from there. So
Again, we work closely with you.
Yeah,
and
we
come
do.
around and ask questions. And
Yeah, we
yeah,
do.
it's nice team environment.
Yeah, so it's really good. We work closely with midwives.
Almost all of the women who live in this area can have their scans in Banbury. There may be some exceptions, but almost all women can have their scans here, which is great to have that local service here. Yeah, that's good. Yeah, great. Any questions for Katie about scans? Does anybody want to? Yeah, just hang on for a couple of minutes in case anything else comes through about scanning for Katie. Do you want to take that one?
So as everybody knows, we're having partners back.
Yeah.
So partners are coming to join their partners to have their scans. So that's good news. Providing nothing changes. If it did, then we'd let everybody know. But no children, and just one person to accompany the person for their scan.
So we have another question. Where are we? So Anne-Credit says it's first pregnancy and was wondering what average length of labour is. At which point would you be transferred to the JR because your labour is taking too long? So that's a good question. It really depends on usually what number baby this is for you. So if this is your first baby, it usually takes longer than if you've had babies before, because your body's very clever and usually remembers what it's done. So for your first baby, when you get to established labour, which is around about your cervix being 4 centimetres but having regular contractions, usually the cervix dilates about half a centimetre to a centimetre an hour. So that's really, really rough. So some people it's much quicker than that, some people it takes longer than that. So it could be potentially 12 hours or so, which is fine. But if you've had a baby before, it's usually a bit quicker than that, probably around about half that time. But again, it does vary. And at which point would you be transferred if labour was taking too long? So when you're in labour, we offer vaginal examinations. These are always optional, like anything, but we will offer an examination perhaps when you come in initially, just to see at what point or what your cervix is doing when you might be in labour, amongst other things. We're watching and looking and maybe feeling contractions and just observing. So we may examine and like we said, we do the examinations we offer them about every 4 hours roughly in labour. So if say you were 6 centimetres, we probably expect maybe to be about 8 centimetres 4 hours later. So if you were still 6, we wouldn't transfer usually right there and then. You know, there are things that we can try to help speed labour up a little bit. So it could be, like Tammy was saying, changing your position, making sure that you've passed urine, because that's really important in labour. So we encourage you to go to the toilet every couple of hours, because if you imagine if your bladder is quite full, it's going to get in the way of baby coming through the pelvis. So emptying your bladder, moving. If your waters haven't broken already, we might talk to you about possibly rupturing those to speed things along. Then we would wait, providing you and baby are well, and maybe assess again in a couple of hours. And if then there is not much progress, then we would talk to you about potentially going to the JR for some extra support. Hopefully that answers your question.
A couple of things come through for you, Katie. What does the sonographer check at the 36-week scan? And that was from Margaret as well. And from Louise, is the 36-week scan something that happens for all pregnant women? My friends from other areas don't seem to have this service.
No, it's something quite unique to Oxfordshire. So we scan patients at 20 weeks and we check the blood flow of the sort of circulation of the blood flow getting from the mother to the baby. And depending on that blood flow circulation depends on when we scan ladies again. And there's a few questions we ask at 20 weeks as well, which will indicate whether they have another scan at what gestation. So routinely we scan everybody at 36 weeks. Occasionally there are scans at 28 and 32 weeks for ladies with sort of certain risk factors. And at 36 weeks, so we check the growth of the baby, so make sure that the baby's growing okay, we make sure that the head's down, make sure that the fluid around the baby's fine, make sure that the blood flow getting to the baby from the placenta is fine and coming up to the baby's brain is normal, and we check that the placenta is out of the way, ready for delivery too.
Thank you. And Vanessa, yes, you can bring your tea lights in. I'm assuming that they're battery operated because we can't have any naked flames. But yes, you can bring your colour change night light as well.
You have ladies bring their fairy lights, don't they?
Yes, fairy lights.
Yes.
Yeah, battery
Very
operated.
nice.
It is possible to have the main lights in the room very dim, and or even off, and if the midwife may just need a little corner of the room with a very small angle poised lamp, just so that she can sit somewhere and write her notes. But yes, we're quite used to working under those lovely relaxing conditions.
I just wanted to say as well, with hypnobirthing, we've got positive affirmations on the walls as well. So if you have any that you really like or you can really relate to, and you want to bring them in, that's absolutely fine, and we can find somewhere to put them, because they can be really encouraging when you're in labour.
Question from Jenny here. Oh, Vanessa says yes, they're battery operated. Lovely, thank you. Yeah.
They can come. They can come.
Yeah. And Jenny's asking, if you come in at 4 centimetres, at what point would you usually get into the pool? Well, probably at that point you would be able to get into the pool if you wanted to. That would be absolutely fine. So if you come in and you're less dilated than that, we might suggest that you mobilise for a little while, try some massage, some aromatherapy. But again, it's a combination of things. It's not just how dilated your cervix is, it's how well your contractions or surges are coming and how often. So there's it's a holistic approach. It's not one thing really. But certainly, Jenny, if you arrived and you were 4 centimetres and you were having regular strong contractions or surges, then that would be fine to get in the pool at that point, yes. And we've just got another guest arrived, I think, who's hiding around the corner. Oh, here you are. Come on in, Jackie. Yes. So this is our, one of our lovely hearing screeners, and who's just going to briefly say what we do here in terms of the hearing screening for your baby.
Hi, I'm Jackie and I have the lovely job of managing the newborn hearing screening. We approximately screen about 7,600 babies per year. We're based here at the Halton and the John Radcliffe. We try very hard to screen all the babies before you get discharged, but sometimes that's just not possible, so we may have to see you again. There are reasons, sometimes several reasons, why we don't get clear responses and we have to see you again, and that's one would be a hearing loss, one would be early discharges, or there's just lots of fluid in the ear and sometimes testing conditions. So we're just trying to arrange an outpatient appointment as near to where you live as possible. The newborn hearing screening is a non-invasive test. It doesn't harm or hurt your baby, and we do require a settled baby, and there is no risk associated with having the hearing screen. We do try to screen every baby before they're 4 weeks of age, because late identification of deafness can have a delay in a child's development and the communication and language. So the earlier we find a hearing loss, the better it is for the baby. Saying that, the prevalence of a baby with a hearing loss is 1 to 2 in 1,000, so it isn't very many. Babies that have been admitted to special care is 1 to 2 in 100, so there's quite a significant between the two. 90% of the babies we find with a hearing loss are born to parents that have hearing, so sometimes that can be quite a bit of a shock. So it's just something we encourage everybody to have the hearing check done, but it is actually a choice. You don't have to, but we encourage everybody as much as we can to do so. And basically, babies start hearing at 24 weeks of gestation. So the more talking you do to them, the better. And I think that's all I have to say, but thank you very much.
Thank you.
Nice thing to finish on.
Yeah, that's absolutely fabulous. Thank you.
Thank you very much.
Yeah. Do you have any questions before you go, Jackie? Any questions for Jackie? Sorry, about hearing screening. There's nothing coming through at the moment, and I don't think there are any more scan questions. Oh, there's one from Nikki. When would a breech delivery be picked up? Would it be at the 36-week scan? Can you deliver a breech baby in MLU, or would this mean transfer? So yes, often breech presentation is picked up at the 36
Yeah,
week
we do
scan.
pick it up at 36 weeks. That's what we're looking for, to see if the baby is head down or not. And if the baby is in a breech position, then we do get an appointment for that patient to be seen over in Oxford following Monday or the Monday after that, depending on whether it's their first baby or not, to see somebody on delivery suite over at the John Radcliffe in the Breech clinic.
And as far as can you deliver a breech baby in MLU, or would this mean transfer? If breech presentation was diagnosed in your labour here at the MLU, it would be an indication for transferring you to the John Radcliffe to be as safe as possible for you and your baby, because it's all about the appropriate and safest place for your delivery. So we would transfer you in the ambulance, and a midwife would go along with you. we wouldn't plan to deliver a baby here who was in the Breech presentation. So that would always be at the John Radcliffe. At the John Radcliffe, they've got a specialist Breech team, and the obstetricians are on hand if required. I think there's nothing else come through. Yeah,
Thank you. Is
Thank
there
you
anything
both.
for Jackie? Was that?
No, nothing's come through about that. I think, yeah. Oh, hang on a minute. No, it's not a Jackie question.
Thank you. Thank you very much.
Thank you, Jackie.
Thanks.
Yeah.
Thank you, Katie. Thank you, Katie. That's all right.
I think another question that I was just
Bev, come in, take a seat.
okay.
I'll sit at the back. Take a seat.
Actually, Bev, you can just talk about this. So I was going to say about if anybody needs stitches, because that quite often gets asked, isn't it? If we can do that.
Yes. So this is one of our lovely MLU midwives. This is Bev.
Hello.
Who's going to answer that question? What was the question?
Well, I just thought sometimes we, as community midwives, are asked if I needed to have any stitches after baby's born.
Yes.
Can that be done at the Horton?
Yeah.
Okay, so hi, my name's Bev. So I work here on the MLU doing day and night shifts. Obviously we're open 24 hours, and we tend to do 12-hour shifts so that you hopefully will have a midwife with you continuously throughout your labour without too many swaps and changes. So just talking about the stitches, if needed afterwards. So sometimes during the process of birth you do suffer a small tear, graze, that type of thing, that may need a few stitches afterwards. And the midwives here on the MLU are trained in suturing, and we can do all the suturing ourselves after the delivery. So we do that in the room, usually pretty quickly after delivery, so that we can get that out of the way, so that you can go on and have your normal skin to skin with baby. And the skin to skin and breastfeeding things can actually take place while that suturing is happening, and we can try and keep you all together and having that rooming in time as well, and get that stitching out of the way, and then so yes, that can be done.
So then if it's a bigger tear, that's sort of out of the remit of the midwife doing, then that would be then transferring to the John Radcliffe. Obviously that's not necessarily an emergency situation, but we would go down to the John Radcliffe for that.
Something that I didn't say with transfer earlier as well is that even any situation we would use, like I know I said we use the ambulance, but we would use the blue lights, wouldn't we, even if it's not technically an emergency situation. Generally we do that just
so that we can get you there as quick as possible time.
Through the traffic, nice and quick.
So while we've got Bev here, I've got another couple of questions for her. So this one's from Jodie, and she says, from experience, generally our third babies quick labours and births. Due her third baby in a week, previously been induced at 42 weeks, and a little bit concerned that it might all happen naturally, and it will be really fast. And I'm just wondering, Jodie, are you planning to come to the Horton? But anyway, I'll hand that over to Bev.
Okay. So I would say with a third baby, it's pretty much like a second baby, to be honest. So first babies are the ones that tend to take a little longer, usually, not always. But second babies, just because your body has done it all before, it kind of remembers what happened the last time. And the same with the third. So it usually happens quicker than your first, and the third baby is quite similar to the second, really. So what we say is to look out for those early signs. You'll still need strong, regular contractions in order to have your baby. So it's not going to suddenly happen out of the blue. And what we would say that, if you're having mild contractions, if your waters went, that would probably be a time to call us. So if your waters went, give us a call, even if your contractions are not really strong and regular,
or if you've got those strong regular contractions and your waters is still intact, that's probably the time to give us a call. But at any time, even if you're just having some niggles, you can phone us and chat it through with us, and we can know you're out there, know things are going on, and give you an idea of, you know, when to call. And we're quite happy for you to phone us several times before you actually come in.
So Jodie has said that she is planning to go to Oxford, but exactly the same advice would apply. You would just phone Oxford instead of here. So that's what you'd need to do, Jodie or anyone else in that in a situation. The one for Tammy now. This is from Anchorage. If you opt for a spontaneous placenta delivery, so a physiological third stage, how long would you be allowed to wait for the placenta to arrive naturally before you're offered an injection?
Okay, so normally if you have a physiological third stage, we don't do anything. So once the baby's born, we leave the cord intact. We deliver your baby skin to skin, and we let you just have skin to skin time with you and the baby. If you're wanting to breastfeed, then it would be a great idea to try and get your baby to go to the breast, because then by the baby sucking at the breast, then that can help your uterus contract. And often not that process will happen within, well, actually quite normal, isn't it? And it's the same as if you have the injection. So 10, 15, 20, sometimes minutes after, sometimes half an hour after. And as long as you weren't bleeding or anything, then we'd be happy to let that happen. So that's often how long that will take. Can't quite remember what
I think if we get to about half an hour, we're kind of looking, hopefully, for your placenta to be delivered. But but if the bleeding was minimal and that kind of thing, then we can possibly give it a little longer. If we're starting to push towards the hour, we would be thinking of moving away from here. So yeah, I mean, probably somewhere between half an hour and an hour would be looking to give you the injection, if that was what if you agreed with that. And if not, then maybe we would need to transfer if the placenta still haven't delivered at about an hour.
We've got other things we can try as well. We've got aromatherapy is often something that can help as well. So
sometimes just movement, changing your position.
You know, if you delivered in the again, empty your bladder. If you've delivered in the pool, then you know, often just sort of getting up and being a bit more, you know, once you get out of the pool, often that's enough we'll sit you on the toilet. So there's lots of different things that we can try.
Well, we've got about 5 more minutes left of this live session. So if there are any last minute questions, please send them in to us. Otherwise, I think we will just thank you very much for watching, and obviously you can watch again. And I think I'll just hand you over to Rachel to tell you a little bit about the Horton MLU Facebook group as well.
Yep, so we've recently set up a Facebook page, which is really good news, so we can share information on there. The plan is to share lots of regular updates about what we offer here at the Horton. So if you search for the Horton Midwifery Led Unit and Maternity Services, it does come up. It can be a bit tricky to find, but it is there. So please give us a like and a follow, and we'll share lots of information with you. We'll share this video on there as well.
A last minute question from Carly. Is it possible to have more than one stretch and sweep? Yes, it is. It is possible. There's no real contraindication to that, Carla. We have during the COVID restrictions just been offering one stretch and sweep when you go past your dates, just to minimise contact. But in some circumstances, it may be that you would have more than one stretch and sweep. But that would be something that perhaps you would need to discuss your individual case with your own midwife, or you're very, very welcome to ring us up afterwards. And there was A question from Nicole earlier on. Nicole, if you would ring the MLU, we can talk about your individual case. So that's 01295 229459. So give us a ring and we'll answer your question for you, because that's a little bit more personal to you. So we look forward to your call. And I think something last minute's coming in. Yes, you're Carla, 40 weeks and 1 day, and you've been told that you can only have one next week. That is our policy at the moment, Carla, but at 41 weeks. But please do give us a ring and we can discuss that with you if you would like to. I hope that helps. Anything last minute? 2 minutes to go. Anything you would like to say? No? No? Well, I think there's a lot of staff hiding behind the door that haven't come in to say hello today, and we'll be talking to them afterwards. Maybe on our next session, which I believe may be in October sometime, date to be arranged, then we can entice them in then to say hello to you. But it's been lovely talking to you today. Thank you very much for watching, and that's all from us. Thank you.
Thank you very much. Bye.
Bye. Bye.